aching with pain, you really need to do this massage. Easiest done in the shower, just doing a gentle massage around your masseters. And then I want you to come down to right where the ear meets the jaw, up and underneath, and just do one side at a time and really dig in there. That's the posterior capsule and the back part of the disc, and you can really rub in there. Don't do both sides because you can feel a little bit dizzy as your main arteries are there. You can't do any damage, and then you can rub down into your swallow muscles. As these muscles become overactive when you have swelling and pain in the jaw muscles, we only need 10 mils of swelling to switch these muscles off, and then your jaw, your swallow muscles will overwork, and you can feel quite constricted through your throat. You can feel like you want to cough, and you can feel quite phlegmy. So it's nice to really dig into these and give them a good rub. Now, the other place to rub is inside your mouth, just to release the in part of the masseter. So just taking your finger and sliding it between your cheek and the top row of teeth, and then meeting it with your thumb and just holding and giving it a little bit of a squeeze. We only want a dull ache, no sharp pain. So it looks like this. And you can take your finger right back along that front row of teeth. It's the top part that gets into the muscle belly better. And you're just holding until that releases, until it's not too sore. So 10 seconds, 30 seconds until it releases. The other muscle to check is your medial pterygoid, that's quite deep in the side back of your throat. So you're taking your fingertip, putting it on the bottom last tooth, and then going around the back of the jaw joint between your tongue, not between the teeth and the cheek, but down into the back of the throat. You'll feel a curtain sling of muscle, and wherever there feels like there's a little round knobby part that's quite knotty, or if it hurts, that's an indication you need to press on it gently until it releases. So I'll show you what that looks like.